You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. Jeannie Roller, my co-host, and I have started this podcast a little while ago, Jeannie, probably 2 years or so, after the medical harm that we had done to us in the system that we couldn't believe that this was day-to-day practicing nowadays. You know, call us old, whatever you want to call us. But we believe in the respect and dignity for patients has not gone by the wayside, as in our opinion, even in this day and age, and when we're recording the show. And we're going to talk about that today. Jeannie, you brought the topic to me once again, and ours is a rebuttal today about an article that you read about what not to do in the medical arena as far as the patient goes. Like they're telling us in that article the patient should not do this to the medical personnel. So we want to talk about what the medical personnel should not do to the patient, because this is a two-way street. I feel sorry, and I've said it so many times, and so have you, Jeannie, that for the people that are trying to do a really good job in this now healthcare arena, and that's what it seems like, in my opinion, is an arena. And of course, these are all our opinions on this show. We're not doctors, we're not lawyers, we're not any of that. We're just harmed patients, and that's how we got involved with this, which is a lot of times what happens to people. Something happens to you, you cannot believe it. You want to try to help the next person so it doesn't happen to them. And that's exactly how we got involved with this, Jeannie, you and I. So go ahead and start with that, about what patients should not do to the medical arena, and then counter rebuttal it with what we should not have done to us. It's just insane. I have one pet peeve that I want to bring up. Go ahead. Actually, two. Go ahead.
Well, actually, my rebuttal is all about what shouldn't be done to the patient. I mean, the article was published by the HuffPost on February 5th.
Okay.
It's called The Rudest Things You Can Do at a Doctor's Office. And they mentioned things like eating, being late, asking other people what their ailment is, et cetera, et cetera. But it was a long-winded list. But what I didn't see was, the flip side, and that's what you and I concentrate on, is the flip side. And so my first thing is, when you walk in the door, don't ask the patient what they are seeing the doctor about. Remember, waiting rooms offer no privacy, because they always have you either sign in, and a lot of these places still want you to sign in on the sheet saying what you're seeing the doctor for, or they ask you, and there is absolutely no privacy in that. Is something that shouldn't be happening. So, and that brings me on to the next one. If they are using a sign-in sheet, then completely remove the patient's name and everything from that sign-in sheet. They should have like little tear-off strips or something that they can just tear off the patient's name, because no one should be able to look up and down a list and see a patient's name or what their ailment is. Not only that, some of them will cross it out. Well, crossing out a patient's name isn't going to protect their privacy, because people can read through the lines. And also, patient privacy is guaranteed and required by HIPAA.
Right.
So patients should feel like their information is private.
I want to make a comment about that, Jeannie. So what I do when I go to the doctor's office, and I started this a while ago because I'm with you about that, I just give my last name. I won't put my first name on there. They can call me whatever, and I put as least amount of information as I possibly can. I won't put down what I'm seeing the doctor for. I'll put down the time of my appointment and my arrival time, and if I'm a new patient or no, and that's it. I don't put anything else on it. I won't, because I'm with you.
That's good.
Yeah, I'm with you. I'm not doing it.
Yeah. Well, and the other thing they need to make sure is, when they ask the patient for personally identifiable information, that others in the waiting room or in line cannot hear this information. Right. We are just more than insurance cards or Medicare, Medicaid numbers.
Yep.
Don't ask for information until you properly greet the patient by saying hello or something. But, just don't automatically snap off, I need your information. I need your insurance card and your driver's license.
Okay. And what I do with that too, because I have one place here, can't mention any names, that notoriously yells the stuff out. Your address, your phone number is 515 blah blah blah. You're still no. Right. I tell them, please do not say any of my stuff out loud. I hand them a piece of paper with all of my little card with all of my stuff on it, and that's it. I don't want you asking me the stuff out loud, because it is a HIPAA violation. That's it.
Right. And Cindy, I kid you not, we were in a waiting room and the medical assistant yelled out across the room to this older lady, are you having this and this and this done today? Different types of x-rays and tests. And do you still live at this address? Is there someone there to pick you up? I mean, she just gave the full rundown on the lady's life. And I'm like thinking, well, she's lucky that we're in there because we're not going to go and rob her or take her. But I mean, it's just, they don't seem to understand.
I went to a mammogram. It wasn't a mammogram appointment. I was in this similar place, that does mammograms and does X-rays and all kinds of stuff. And they literally, Jeannie, I could not believe this. And this is for the listeners. I mean, to me, this bothers me. And I had to stick up for the woman. They literally asked her out loud if she had implants. Are those implants, ma'am? And I was like, what did you just ask her? Are you kidding me? You don't ask that kind of stuff in a lobby. There was like 25 people in the lobby. You don't. I mean, this is just, it's ridiculous. And the woman was so embarrassed, rightfully so, that it's just criminal, in my opinion. Go ahead, Jeannie.
It is. Well, the other thing is usually at least once a year, they want you to re-sign their privacy HIPAA forms. And my pet peeve is when you ask to see a hard copy of those, because they just really want you to sign it on a little tablet. Most of the time, sign here. They act irritated when you want to see the forms and read them before you actually sign them. So don't act irritated. I don't blindly sign anything. I read everything. So it is my right to be able to read what I'm signing. So don't act irritated.
I agree with that. The same things happen to me when I ask them, I'd like to read this. Or if you take too long holding the tablet to read that is the same thing. Are you done? Are you done? Are you done? Aren't you done yet? I agree.
The other thing is when calling the patient into the exam area, make sure not to address the patient by their first and last name, because then that tells everyone in the waiting room who that patient is. But also, don't address them by their first name unless you have been given permission to do so by the patient. In a prior visit, there should probably be a notation on the file that somebody likes to be called Mrs. Smith rather than Jane. There are different ways, but they should not use the full name. And they should not be, in my opinion, using my first name because we aren't buddies. So
a lot of places, I get you on that. A lot of places do use your first name only because it's like, maybe I'm being the devil's advocate here. Maybe it's less descriptive, if you will. So I'll just say that.
Yeah, I can see that. But I'd rather be given a number at that point. Number 2.
I get you. It's every place is different, so that's not uniform, but I get it. Yeah. One of my pet peeves, and we talked about it before we went on air, are assistants or whatever the terminology is, medical assistants, medical whatever, that you go into a room with them and they're doing your vitals and whatever, and they have 3-inch press-on nails on. I mean, that just drives me insane because one of the things that they teach you, I mean, look at how long surgeons scrub their hands to get the dirt out from underneath their fingernails. So we know that for a fact that the fingernails are filthy. And now you have, I'm not in a surgical atmosphere, but you have people with, 2-inch, 3, and I've seen 3-inch, and it's just crazy on how that is allowed in the medical community. I don't get that. They can scratch you, they can whatever. And I've been told that you are not, as the person, allowed to say anything about that because it's their right to have that in the human race, if you will. And I know I'm not quoting that or saying that the right way, but you're violating their rights by saying that's interfering. So
if those 3-inch nails scratch me or peck me, then they've just violated my body.
Right. Well, that's
by physically harming me.
I just don't think it's I don't think it's a medical system. That it goes in the medical jive. To me, it just doesn't. It doesn't. Yeah. Yeah. Anyway, so what about those things for the patients? We've got like 5 seconds left, Jeannie. Just quick wrap up.
Well, the other thing is weighing a patient. They usually do it in a public hallway once they get into the exam area. So make sure there's no one around when you call out the weight or.
Oh yeah, most of the ones I know don't call it out, but they do it in the hallway. On that note, stay tuned to Evergreen Media Network. We'll be right back.